Dave Passey is a graduate of the Gandhi Medical College in Bhopal, India, and came to the United States in 1973. Finished his residency in pediatrics at Worcester City Hospital and did a fellowship in ambulatory pediatric care at Memorial Hospital, and has been in private practice since 1978. He has served as president of the Worcester District Medical Society and has served in leadership positions with the India Society of Worcester, the American Association of Indian Physicians, the Massachusetts Medical Society, as well as many community organizations. In 2005, he began a free clinic at the India Association of Worcester, along with the India Medical Association of New England. Thank you for taking time to speak with us, Dr. Passey.
Thank you, Dave.
Now, you have had experience both as an immigrant yourself, as well as delivering care to the immigrant population today. Let's talk a little bit about your experience as an immigrant. You came over in the 1970s and trained here in Worcester. How was that for you?
I came to Worcester in 1973 after graduating from Gandhi Medical College, Bhopal. And when I joined the medical college, that was in 66. And there was a big difference with the medical education, what we received in 60s, and then what we were facing here in the United States in 73 onwards. My mostly experience have been more patient care, direct patient care, and we saw more volume of patients and variety of diseases, and did not have the technology to investigate and x-rays and CT scans and things like that. So that was a little different for me when I started here in the city of Worcester. And prior to coming to the city of Worcester, I had spent 1 year in Winnipeg, Canada. I had done an internship there in a Victoria General Hospital in Winnipeg. And that has given me a little bit of background before I started here in Worcester. And even during my residency program and internship program, it was when you were dealing, I was at Worcester City Hospital, so that was a hospital which provided the care for the very poor segment of our society. And as caring for those patients and the children at the city hospital had given me a different view of how the medicine is being practiced and what need to change. There had been a quite different how the people, those who were in dire need and had a lower social economical strata, how their medical practice, how they see the medical care compared to the elite. And after working through that I would say last 40 years now, things are coming to more a level position now where the medical care and the quality of care seems to be at par for both segments of the society. But there is still a lot of work needs to be done to call it as a equal.
Mm-hmm. How has your experience as an immigrant affected your ability to deliver care?
The main thing which I feel that being an immigrant, when I came here and when I started my practice, I was more able to relate to the people, those who were immigrant or refugees, those who are coming to this country and trying to settle down. And it gave me a little bit more a kind of an opportunity to relate to them, where I could relate to the situations they have been through and how they feel when they have a difficulty communicating and they have a language barrier. And then sometimes they are not able to afford the medicines which is being prescribed, or not understanding what had been explained to them. So, I mean, and also being from a different ethnic background, it gave me an opportunity to also look at a lot of, during my practice, we have a lot of Vietnamese, those who I took care of, and they use their native medicines. And there is a term called quinine. Whenever somebody had a cough, cold, or a fever, a quine was used on their back, and that was their home remedy. And we used to see the people come in and sometimes come into the emergency room, and the emergency room physician, those who were not aware of the term quining, were ready to call DSF and report a child abuse. Mm-hmm. And we had patients in my practice, those who have asthma situations, and but the grandparents and the family would not bring a child to the physician's office because they were treating them at home with so-called quining. And when we used to see patient in my office, we used to lift their shirt up so we knew what has gone on with this patient at home. So I used to always tell them, I used to tell the parents, and if the grandparents in the room, I used to tell them, what you did is wonderful. This is what gives you comfort. That's okay. But next time when you do the quining, please follow it up with a nebulizer treatment. And so both can work together for this child. Mm-hmm. And we had quite success with that. And I still have the grandparents, those who are bringing their third generation to me. And we still laugh about those situations that we had to go through. This is just an example. I think being an immigrant, I had a little bit more compassion and a little more empathy for the people I care for, because they've been there.
Yep. And can you talk a little bit about the motive to start the free clinic here in Shrewsbury through the India Association and what you've experienced there?
Okay, thank you, Dan. I have been in Worcester since '73, and I was part of the Indian Medical Association of England, started in 1978. And from 1978 onwards, it was a group of all the Indian physicians in central Massachusetts, in the whole New England area. And we used to do a free clinics at the churches, the Hindu temples. And we used to do any kind of festival or something. We used to set up a little booth and provide free medical care and a screen for people. And in 1989, we had started a program called the India Day program in the city of Worcester. And so we used to do annual program where we used to have a full-blown screening program, which included even the bone density and blood pressure and vision and all those kind of things. And during the same time period, the India Society of Worcester had bought land in Shrewsbury, and we were building the India Center, which was put on the ground in 2004. And I had served as the president of the Indian Medical Association and also as the president of the India Society of Worcester. So it wasn't very difficult for me to convince the two organizations to start as an ongoing clinic to provide this ongoing care for most of the time. The patient, what we see right now are the visitors, those who come from India, and they spend 6 months in the United States, where during that time period, they do not have any medical health care and no insurance. So they are always looking for somebody to provide some medical checkups and help to them. And we used to do that in our offices to accommodate these patients, to provide them the care what they needed. And so in 2005, after the India Center was put on ground in Shrewsbury, we started this free health stop on every Wednesday evening, and it has been going on for the last 18 years. And We provide the care for mostly I would say about 80 to 90% of the patients, those who walk through our door, are of the Indian origin, and not necessarily being the immigrant or a visitor. Even the people, those who live and have a medical insurance and have their own PCP, they also come and visit us because sometimes they want to have a second opinion on something. So they are going to visit us there. And being as you know, that India is a very diverse country, and we speak almost hundreds of dialects. So every Wednesday evening in our clinic, we at least have 5 to 6 different languages spoken. So we are able to provide that kind of care to our population, those who come through, and they feel a little bit much more comfortable because they are able to communicate with our physician in their own languages. And very recently, for the last, I think 4 or 5 years, we have been seeing a lot of the immigrants, those who are coming from Brazil, and now we are seeing from Haiti and Ghana, and also from Afghanistan. And a lot of children, those who are coming in, those who need school physical exams and get ready for schools. So we generally provide that care. And the patient, what we see, most of them have the same chronic diseases as anybody else sees, mostly the diabetes, hypertension, and other physical exams, refill of their prescriptions. And we are glad that we are able to provide that service.
Well, thank you for doing that, and thank you for taking the time to speak with us today.
Thank you, Dale. It's my pleasure.